Let's talk more about the uptick in COVID-19 cases. Joining us tonight is testing czar Vince Dizon. Mr. Dizon, welcome to the big story.
Thank you very much, Robbie. Thank you, Gretchen.
Sir, is there what is the level here where the concern and also the protocols will also kick in to become stricter? I mean, you heard Okta Research here saying that they're predicting that by the end of the month, if the trend continues, we could be looking at 6,000 cases per day.
Let's put things in perspective, Robbie. In August of last year, the entire country peaked at roughly more than 8,500 cases per day. That was our peak. And through combination of stricter restrictions and pushing the minimum health standards, pushing our testing, our tracing, our isolation, we were able to very quickly bring that down and kept it stable until these recent surges in the past week or so. Right now, we are roughly at about 3,500 per day, still way below the 8,500 we experienced in August. However, it is very important to note that we must intervene more and we must enforce our rules harder. And the most important and the most powerful and effective tool that we have is really the enforcement of the minimum health standards. The wearing of masks, the washing of hands, the distancing as much as possible. So we have already met with our local government units and all our DOH regional units, especially in the areas of NCR, Region 7, Region 4A, Region 11, and the Cordillera Autonomous Region, to more strictly enforce the minimum health standards as well as our detection and isolation protocols. So we are doing that right now, and we are really intensifying all of that. I heard about the questions on restrictions. No, right now we are at a point where we really need to balance between doing the restrictions that we did last year versus how these will affect the economy, because we are also facing an economic crisis right now of less jobs, less livelihoods, at the same time rising prices. So that needs to be balanced, but the DOH has already said we will do more localized lockdowns when necessary, and we will intensify our prevention, detection, and isolation interventions at the local levels.
Sir, the emphasis, and DOH was saying this also, the emphasis on minimum health standards and reminding people, don't let your guard down, reminds us of the early months of this pandemic, where basically government was saying, disiplina ang kailangan. But there was a pushback there where people were saying, look, we're disciplined, but there has to be protocols, and we need government to signal that we are taking this very seriously. What basis do you actually have to say and to essentially blame the behavior of people and not these new variants? Because all things being equal, the baseline number that you mentioned from August from our peak, we brought that down to around 1,000 before the end of the year. So all things being equal, you would see that people are behaving. They had the behavior as early as November and December, and now it's going up. Could it be another factor such as the new variant?
First of all, Robbie, no one is blaming anyone for this. What we are stating are facts coming from experts that 85% of transmission can be prevented by the minimum health standards. That is simply a fact. We are also saying that we are taking this very seriously. In fact, the IATF, Secretary Galvez, Secretary Duque, has already said that the initial recommendations to further loosen restrictions is already under current review. And in all likelihood, these will not be implemented because of the surge in cases from roughly about 1,500 cases when those recommendations were made to open cinemas, etc., to now where we're hitting 3,500. So clearly, that sends a very clear signal that we are serious. We're not going to loosen up. And if necessary, if and when necessary, we are going to lock down in the same way that LGUs like Pasay and other LGUs in NCR have already conducted localized lockdowns.
Okay. Testing Chief Vince Dizon, maraming salamat po.